Hello everybody, it's Captain Klein here and welcome to episode 11 of Q&A with the Captain, where we answer your questions and try to provide you with helpful information to get everybody through the COVID pandemic. This week I want to start with a Bravo Zulu to our security forces. A quick shout out to some folks who are doing a great job. So while many parts of our command have dramatically altered or even closed down operations during this pandemic, our security forces, not only have they stayed the course throughout, but I would say they're operating in probably the most complex security environment that I've seen in my entire career. The last 6 months, the changes that have been directed to us for security have been amazing, and our security folks are out there doing it every day with every bit of professionalism that I expect them to have. And I just wanted to give a shout out to a couple folks in particular this week: MA2 Walton, GM2 Jones, HN Whitman, MA2 Zero Canaan, MA3 Stokes, and MA1 Matthias. So this week they responded to a gate runner at Portsmouth Annex, and just a textbook response that ensured there was, they de-escalated the situation, there was no damage, no injuries, and less than 30 minutes had the gate back up and operating and supporting the Naval Medical Center traffic. Thanks to these sailors and really all of our NSF for the continued vigilance. If you see those sailors out there, please give them a physically distanced pat on the back and say thank you to them. So as we continue to become more educated on the virus, I want to make sure that we're ready to transition to our new normal when we do move to phase 2 of our reset here. So today I've been asked to provide some reminders on our policies and procedures. I'm going to start with face coverings. So as you know, as a naval installation, we're going to continue to follow DoD guidance on face coverings. In our workplaces here at the headquarters and throughout the NSA Hampton Roads enterprise, face coverings are required anytime you're in a common area, any face-to-face interactions with in a customer service role, and anytime you can't maintain the 6 feet of physical distancing that's recommended by the CDC. So everybody has to have this with them, and whether it's in your pocket or on your person, you need to be ready to put it on, and if you work in your own office, when you come out into the common areas, you should be wearing your face mask. I think we can all agree that face coverings can be uncomfortable, especially if you're outside, especially if it's hot. But that discomfort really is a small price to pay for protecting each other and slowing the spread of the virus. Every time I get tempted to complain about it or feel sorry for myself for having to wear, when I think about those healthcare providers, frontline personnel, emergency service workers who are wearing their masks 8 or 12 hours a day, and suddenly it doesn't seem like that much of a hassle. Off duty, I have to ask you to continue to wear your face mask and take those protective measures when you're out in town and protect yourself and those around you. So next topic is the stay-at-home order. So Virginia had a stay-at-home order that was in effect until the 11th of June, and then they've slowly been going through their phased reopening plan. They're in phase 2 right now, and as a matter of fact, the governor announced on Tuesday this week that he expects Virginia to go to phase 3 next week. I think it was Wednesday. But as you know, our installation follows DoD and Department of the Navy policy, and as I discussed last week, we get a weekly update on our medical intelligence from our medical folks, and they give us a recommendation on whether or not the Hampton Roads area is ready to move forward meeting the DoD and Department of the Navy criteria to go to HPCon Bravo. So this week's assessment identified that there has been a continued upward trend in positive cases amongst military forces in the Hampton Roads area. It also identified that the largest cities, we're tracking about 16 different cities and counties between North Carolina and Virginia, they don't meet the criteria of a downward trajectory of cases over the last 14 days. As a matter of fact, a couple of them that were in the green last week have moved back to the yellow and into the red as far as the trajectory of cases. So as a result, our recommendation up to Naval Region Mid-Atlantic and therefore to CNIC and NAV North is it will remain in health protection condition Charlie. That means, of course, our military personnel are directed to transit to and from work. Limit your other activities to essential things such as groceries, gas, and pharmacy and medical types of visits. And I know how hard it is to do that. And summer started, the local community has started to loosen restrictions. We have a different role as the military to protect our military capability, our force projection capacity. And so those restrictions that are in place on the military are there for a specific reason. So we have a unique role to play in national defense, and I ask for your continued vigilance as military members, for our civilians and family members, I ask that you take the time to understand the risk that's associated to our military forces from going back out into town to restaurants and bars and gyms and those places where there are large gatherings. And please take the threat seriously. Next topic, we briefly touched on it last week, but personal movement and travel. As you know, the stop movement order that was put out back in April, the result of that has been 42,000 sailors and their families, a backlog of 42,000 sailors and families for PCS moves this summer. NAV Admin 169/20, which came out last week, provides details on how the Navy is going to get us back to moving and get those sailors to their next destinations. So it talks about how they're going to relax travel restrictions and the criteria that's involved in getting waivers and red and green factors as far as the move goes. But it also really goes through the prioritization of those moves. Shore to sea is a priority. Shore to sea, where there's a deploying unit, is a priority. So, as I mentioned, the admin officer and NC1 are heavily engaged in making sure that that we have all the details of that for those sailors of ours that are getting ready to PCS. So, if you haven't read the NAV Admin yet and you're up for orders, I recommend you read it. Even if you don't have orders right now, but you're expecting them before the end of this year, I think it'd probably be a great idea to get familiar with that NAV Admin to understand how it may impact you, your family, and your move. The next topic, of course, is leave. We mentioned it is summer, and we're seeing people out and about moving around. That two-factor process that we discussed, where Virginia is considered green by DoD for right now, and then it goes to the installation level, that is in play for our leave policy right now. So since the Hampton Roads installations remain at HPCon Charlie, will be considered red, therefore we're still restricted to local leave and liberty. Once we go to green, then there is a provision for us to initiate leave out of the area, but you have to be going from green to green. So as you're looking at your leave plans and travel this summer and into the fall, please get familiar with that process. There's a website on My Navy portal with a spreadsheet that shows which states are red and green and which bases within those states are red and green. And then if you're going somewhere that's not associated with a military installation, there are other provisions to figure out whether or not you're red or green. The bottom line is supervisors are going to be intimately involved in approving the leave and the method of travel. And just because the leave is approved doesn't mean there won't be a restricted movement requirement upon termination of the leave. And that does factor into our ability to be able to grant that leave. So please get familiar with the process in the NAV admins. And if you have any questions, bring it up to your supervisor. Or ask the PAO, and maybe I can answer it on the next video that we do. So finally, as we get ready to close out this week's video, I ask that you just remain cognizant of those best practices put out by the CDC. Wash your hands frequently, maintain that 6 foot of physical distancing, avoid crowded places, limit the size of any gatherings that you go to, and stay home if you're feeling sick. For the foreseeable future, we'll be doing that screening at the front doors of all of our facilities, and really the best prevention of this is to not be around others if you're sick. So I think that we've seen a lot of progress fighting the virus over the last 3 months, but it is still with us. And if you're watching the news, I believe it's up to 30 states that have seen a notable increase in positive cases over the last 2 weeks. So we still have to continue to be vigilant, and we have to maintain those measures to try to slow the spread and limit the impact on our operational capability. So again, I thank you for everything you're doing every day. Until next time, please stay safe, wash your hands, and wear your masks. Captain out.